Well, I'd like to thank the Institute of Medicine for devoting a forum to this extremely important topic. And Jill, it's a pleasure to join you this afternoon and have you as our moderator. And Charlie, I'm looking forward to your comments as well. Now, what I'd like to do in my opening remarks is just to discuss briefly the need as well as the possible means for achieving two very important goals. One would be strengthening the engine of innovation that's essential to improving our healthcare system and also meeting the needs of patients, and maintaining an innovation process that also earns the full faith and confidence of the American public. And I think we've heard a bit about that theme this morning. So in the interest of transparency and candor regarding my own interest in this session, I am representing companies that you see and organizations that are up on this screen. So these are my relationships or potential conflicts of interest. These are the members of the Healthcare Leadership Council. HLC is an alliance of chief executives from virtually every healthcare sector, both publicly traded healthcare companies as well as not-for-profit entities as well. Now, our members, as you can imagine, are intensely interested in this issue of conflict of interest and in taking steps that will ensure the public is safeguarded in every respect, whether it's the quality of their health care or the principled fashion in which healthcare improvements do take place. So with this goal in mind, we created an initiative in 2010 that has focused on this issue of physician-industry collaboration. We call it the National Dialogue for Healthcare Innovation. It's a forum for diverse voices to address issues of conflict of interest and healthcare progress. And I'll come back to this initiative in a minute, and you heard Heather discuss it briefly earlier. So as we look at what is in society's best interest, or the individual patient or healthcare consumer's best interest, the list would be much longer than what I have here on this particular slide. But I think we can all agree on certain principles. That medical treatments and technologies should not be static. That we should have an environment that encourages constant improvement and constant innovation. That medications and technologies should be evaluated for safety and efficacy, and those on the front line of treatment, physicians, should have a very major role to play in that evaluation. That physicians should have the means to gain knowledge of what's new in healthcare. The former head of the Mayo Clinic, and actually he was the chair of the Healthcare Leadership Council, Dr. Bob Waller, used to frequently say that in trying to understand everything new that's happening in medicine was like trying to drink from a fire hose. We should have the mechanisms that allow doctors to keep pace with that speed of innovation and get the information that they need. And patients and consumers should not only know what relationships exist between physicians and the healthcare industry, but they also should fully understand what those relationships are all about. Not only the exchanges of value that are occurring, but also the purpose and objectives and the goals of those working relationships. I believe that this context, and that's really what it is, the context is absolutely critical. And I'm going to keep coming back to it for the reasons that you see on this particular slide. When people hear or read of the dollars and value that are exchanged between a physician and a healthcare company, there is among some an immediate negative connotation, as if we should automatically infer that something negative is about that relationship. And yet, I think we can see here that 3/4 of a century of medical progress is due to that physician-industry collaboration. Penicillin, heart and lung bypass machines, statins, deep brain stimulation, all of these came about as a result of physicians, researchers, and manufacturers merging their expertise. So it's not a coincidence that we are a healthier nation today because of companies and physicians collaborating on innovations for the betterment of society. Reduction in mortality rates in so many different categories, such as coronary disease, AIDS, and meningitis. A 30-year gain in life expectancy over the course of the last century. trillions of dollars in added national wealth attributed to people living longer and much more productive lives. Now, am I saying that these statistics showing profound change in our national well-being are exclusively attributed to doctors and manufacturers working in innovative collaboration? No, but those new drugs and devices that I mentioned earlier have had a great deal to do with these statistics. And as we look at the conflict of interest problems and the remedies that can and should be taken against the truly bad actors and bad actions, we need to keep this documentation of healthcare progress in mind to make sure we have the right context. We need to address that problem without obstructing and precluding or having a chilling effect on future advances. Now, I think it's fair to say that the relationships between physicians and industry have received a good deal of scrutiny in recent years. You see a sampling of headlines up here on the screen. And I think it is a good thing that we have ProPublica, that we have a New York Times, and other watchdogs to keep the system honest and to blow a whistle when they see something that is truly out of line. I would venture to say that there are more people aware today of the payments between doctors and medical innovation companies than perhaps there were 5 years ago. However, I would also say it's an open question as to whether they are more aware of the purposes of those payments. But more Americans definitely are aware that these relationships exist. And I think we're all aware that that knowledge could very soon increase by leaps and bounds with the implementation of the Physician Payments Sunshine Act. As we all know, regulations on the Sunshine Act were finalized earlier this year. And so we have a timetable as to when actions are going to take place. Beginning on August 1st, manufacturers will begin collecting and tracking data on their financial relationships with physicians and researchers. It should be noted, by the way, that several companies have already been collecting this data and making it publicly known for some time now. All data must be reported to CMS by March 31st of next year, and then CMS will make this data available to the public on a website that will launch by September 30th, 2014. Now, there's no question that the goals of the Sunshine Act are laudable, and some would say necessary. The public does have a compelling reason to know about these relationships, but the effectiveness of the Sunshine Act will be in the details. When people launch this database on their web browsers next September, will they simply see columns of names and numbers without background, context, or meaning? Or will they understand the degree to which their lives and their health are affected by these exchanges or by these collaborations? Because just providing raw numbers without context it really can have a number, I think, of very unfortunate repercussions. It can create negative presumptions and cynicism over the relationships that are serving society's interest. It could lead to more physicians who don't want to be, cast in the shadow of doubt to avoid these opportunities, and we heard a little bit about that this morning. They will have concerns about being placed in this database and with the possible negative inferences coming from that. It also can have a detrimental effect on the sharing of medical knowledge if there is less participation in conferences and seminars in which pharmaceutical or medical device companies are involved. In a worst-case scenario, I think it could even lead to witch hunts, as people pore over this database to identify which physicians have received the most dollars, even if those dollars are compensating them fairly for their expertise on a project that will advance modern medicine. So as we look at the potential negative reactions to physician industry collaborations, and in fact, not necessarily potential, because some of this is already happening, we have to go back to my comments at the beginning of these remarks and ask, what is really in the best interest of the patients? And that should always be our primary focus. Is it in the patient's best interest if concern over potential conflicts or the appearance of conflict restricts the sharing of medical information and the broadening of healthcare knowledge? Is it in the best interest if academic institutions create impenetrable walls to keep separation between themselves and innovative manufacturers? And is it in the patient's best interest if research into the next groundbreaking innovation is slowed because of fear of conflict or the perception of conflict? Again, I think this really underscores the need for balance and the need for context in this whole discussion. Well, we sought to address this need by, as I mentioned earlier, creating the National Dialogue for Healthcare Innovation. This is a platform that we felt could bring industry, healthcare providers, academics, government, and patients to the same table to air their views on this issue and to try and work towards a consensus on how to establish the parameters for principled collaboration. Now, we started this project with an all-day conference and a discussion with over 100 organizations, including the Institute of Medicine, and we did this at the museum. And then we continued this dialogue through a variety of work groups. Now, our goal here was not to supplant the work done through the Sunshine Act or through the various principles and guidelines established by various organizations such as PhRMA, AdvaMed, or any of the professional societies and healthcare associations that had already spent a lot of time, a lot of work trying to address the subject of collaboration. Rather, what we wanted to do was to develop a multi-sector understanding of how collaborations could take place in a way that enabled innovation to flourish while still earning the public's trust. Well, we were able to reach consensus on 4 key principles, and we really kept this at a high level. And it really represents the commonality among all of these different groups and the work that they had previously done. First was that collaboration must always be first and foremost for the benefit of patients. Second, that researcher autonomy and independence must be protected. Third, that there must be transparency, reasonable access to meaningful information about how physicians, researchers, and companies engage in these collaborative relationships. And fourth, there must be accountability. And we urge that, in addition to the federal law, that there should also be strong internal self-regulation. And I think this self-regulation, or what I would call voluntary compliance, is really a way where you have this within the culture of the organization, as opposed to having it imposed either by law or by regulation. And I think any of those that have worked on various compliance initiatives believe that this is probably a better approach. You see at the bottom of this slide the organizations that were involved in developing these principles: the Association of American Medical Colleges, AdvaMed, the American Orthopedic Association, the Cleveland Clinic, Council of Medical Special Societies, Friends of Cancer Research, the Healthcare Leadership Council, Leahy Clinic, Eli Lilly, Medtronic, and PhRMA. And on this next slide, Yes, on this slide, you can see that many other distinguished organizations and individuals have also signed on and are endorsing these principles. So in summary, I'd like to underscore just how important it is to achieve both of the goals that we've discussed. How do we keep the public fully apprised of these relationships between physicians and industry while strengthening the pace of medical innovation in this country? I hope that people would broadly agree with these points, that it really is in society's interest to encourage healthcare innovation, that the relationship between physicians, researchers, and manufacturers is absolutely critical to this medical progress, that we have to have transparency in these relationships, and also that information about collaborations must be provided to the public with full context. And I hope we can have a robust discussion about that. How do we put this in context so that there really is understanding, not presumptions, but a true and real understanding of what is really created, what is the product, what is the benefit of having these relationships. So I thank you, and I look forward to our discussion.